Hello, my name is Angela Hall, and I am recording a staff development presentation about the COVID-19 pandemic and medication administration errors during the pandemic. In the United States, there were 6,256,971 cumulative hospitalizations since the start of the pandemic, which started in January 2020. January 15th, 2022 was the week of the highest rate of hospitalizations, and cumulative deaths in the United States is 1,137,142 as of August 12th, 2023, and those are the deaths that can be contributed to the COVID-19 virus. The highest weekly rate of deaths was January 9th, 2021, which I believe was the second or third wave. So the total yearly mortality count from 2019 to 2020 rose 528,891, and that is a 16.8 increase from 1 year. It's the largest percentile increase in deaths since the first year that the annual mortality data was made available in the United States. I couldn't find where or what year it was that it was first made available. Those were found on the CDC website. So, the global pandemic, COVID-19, began in December of 2019. It did not really strike the world at large and become a pandemic until March of 2020. March 11th, 2020 was when it was officially deemed a pandemic. In a short amount of time, the healthcare systems across the world had to pivot from a focus on the quality of care to a focus on the critical needs and meeting the crisis level care demands for the population. Hospitalization rates caused a strain on the healthcare system across the world. When they had to change their focus from quality to crisis, there was a definite increase in patient safety adverse events. Things like falls, nosocomial infections, Klebsiella, CODI, and medication errors. I am focusing on medication errors with this presentation. What is a medication error? Medication administration has daily challenges during the usual times, but during the COVID pandemic, nursing staff was faced with even greater challenges. A medication error occurs when a nurse or other medication administrator dispenses medication to a patient that is not correct. The error could be the wrong patient, the wrong medication, the wrong dose, the wrong route, or the wrong time. These 5 things are the 5 rights of the nursing medication administration, and it is a standard of practice. Where is this happening? These medication errors increased in numbers, especially in units that were dedicated to COVID-19, med-surg units especially that were specifically COVID-19 dedicated, and then also areas with a lower nurse to patient ratio. If the nurse had more than 5 patients, that had a significant difference in the risk and the percentage of medication errors that could occur. And then also it was found that it occurred more on night shift. Why is this happening? So, causative factors and the future prevention. One of the major causes for an increase in the medication and adverse events was isolation protocols. There's never in the history of nursing been the level of isolation that we had to put patients through, but with that isolation came literal isolation. We were in the rooms less. The nurses had more patients than they were used to caring for, and there was less time for each individual patient, especially when it required a lengthy process just to get ready to go into the patient's room. Other causative factors are the caregiver's mental and emotional health. Seeing the amount of human suffering and caring for more patients than they we're accustomed to, along with higher workloads, fatigue. All of those things really contributed to a person's mental and emotional burnout. And burnout caused a large number of nurses to report feelings of hopelessness, helplessness, and dissatisfaction with the nursing profession altogether. The increase in the nurse-patient ratio made a lot of nurses feel like they weren't giving adequate care or care that is up to their personal moral standard. So how to prevent this from occurring? In the future, there needs to be more mental health and resilience sources for the nursing staff prior to the event. Preventative measures, as we know, preventative health is always the best thing. Preventative mental health needs to occur too. And then positive work environments. We need to have a shift from blame. And I'm not saying blaming someone for the medication error. I'm just saying the negativity and the finger pointing when things don't go right. We need to focus on a cohesive, positive work environment that's going to have a focus of patient safety, patient first. And then there needs to be more policies for pandemic care, and that includes additional measures for patient safety during the crisis stage. So dual checks with another license, mandatory break times, and limiting the patient to staff ratios, and even buddy assignments where 2 nurses work together to take care of all of their patients together. And that is my suggestions and data on medication errors during the COVID crisis. Here is my references. Thank you so much for listening.